The story of surgery before anesthesia is short and very painful sounding.
Magic sleep. 19th century physicians and dentists taking a stand for health and wellness.
One of the greatest gifts to medicine.
The invention and use of anesthesia took a stand for the health and wellness of all Americans by broadening the spectrum of possible procedures and sparked the development of necessary health regulations, later leading to the expansion of medicine and its capabilities.
London Hospital, built in 1791, was the model for hospital construction in Britain, Europe, and the United States, and was designed because of the lack of anesthesia. The operating room was on the top floor. There was a very heavy door that was closed prior to the start of surgery so that the patient's screams could not be heard elsewhere. The entire hospital staff also helped hold the patient down, gagging him or her if necessary.
Surgery could heal, but the operating room was a place of torture. Many people often chose to die rather than suffer the pain of a knife cutting into their tender flesh.
You train and you become a general practitioner first, you're a doctor. But if you train further and become a surgeon, you lose the title doctor. You're addressed as Mr.
Surgeons were not often called upon as all the patients were extremely afraid of the pain. Many patients who refused a possible life-saving amputation said, "I'd sooner rather die whole." In the 5 years before 1844, only 184 operations had been performed at the Massachusetts General Hospital, which meant an average of about 3 a month. However, when surgeons were called upon, they were always for small surgeries such as amputations because no surgeon dared to go deeply into the patient's body. It was too painful, too dangerous. Surgeons always had to mercilessly ignore the patient's pleas for mercy. This is one of the regular scenarios documented where Dr. John Collins Warren of the Massachusetts General Hospital performed an amputation.
His patient would see his surgical instruments, including knives and saws, and want to run out of the hospital room. However, this was anticipated, so the patient was always strapped tightly to the operating table and guarded by Dr. Warren's assistants. The patient would say something along the lines of,
"Doctor, no operation, let me out of here, the pain!"
And Dr. Warren would respond gently, "Steady now, I know it's a hard thing to lose a leg, but it will save your life. I'll be as quick as I can." The belief at that time, after all, was that the best surgeon was the fastest surgeon. For a leg amputation, Dr. Warren would apply a tourniquet above the knee, grab a knife, and start sawing away. Meanwhile, the patient would yell and scream if they were not gagged and attempt to thrash around, though this was all futile as they were strapped and held down by the nurses.
No, stop, please!
The patient would yell as blood gushed out.
"Oh God, have mercy! Let me die!"
In between the screams, one could hear the rasp of a saw, the crunch of bone, and the thump of the leg dropping into the tub under the table. The knife that heals must first give pain, Dr. Warren reassured himself time after time, for the screams still hung in the air and the cries for mercy still rang in his ear.
Surgeon Valentine Mott of New York experienced similar cries as Dr. Warren. He described his patients as individuals praying in mercy that we would stop, that we would finish, thus imploring and menacing us, and who would not fail to escape if they were not firmly secured. Mott and Warren's experiences were the painful experiences of all surgeons before anesthesia. As a result of dealing with the tiresome and squirming patients, many doctors prefer to treat serious conditions through dietary changes rather than surgical intervention, not to mention that it was nearly impossible to perform complex operations on flailing patients.
Well, like students and teenagers today, in the 1820s and 1830s, students wanted to get high, so they would often breathe in ether or nitrous oxide and stumble around. The story is that somebody fell and got a large laceration on their head, but felt no discomfort.
It was at these events where multiple surgeons came to realize that these substances can eliminate pain, because they saw many people fall on their faces and feel nothing. Many surgeons applied this discovery to their medical practices, and the first medical anesthetic was born.
In 1842, Crawford Long of Jefferson, Georgia, used diethyl ether to remove a tumor from a neck. However, he kept his discovery quiet because he was not in it for the fame or publicity, though this would later change as others began to compete against him. He did not publish his findings and successful procedure until 1848.
In 1844, Horace Wells of Hartford, Connecticut, discovered that nitrous oxide removes pain at a nitrous oxide party. With the assistance of Riggs, Wells administered nitrous oxide from an animal bladder via a wooden tube into the patient's mouth while his or her nostrils were compressed. In the Hartford Courant, Wells explained what happened.
A large number of students with several physicians met to see the operation performed, one of their number to be the patient. Unfortunately for the experiment, the gas bag was by mistake withdrawn much too soon, and he was but partially under its influence when the tooth was extracted. He testified that he experienced some pain, but not as much as usually attends the operation. As there was no other patient present, that the experiment might be repeated, and as several expressed their opinion that it was a humbug affair, which in fact was all the thanks I got for this gratuitous service, I accordingly left the next morning for home. Horace Wells, December 9, 1846.
The reason his patient experienced pain and Wells's anesthetic was seen as unsuccessful and a humbug was not due to his method not working. It is now known that screaming is a side effect of nitrous oxide. The patient didn't feel pain until after the procedure was over and saw his bloody tooth on the table. But this was unknown to both Wells and the observers.
William T.G. Morton of Boston, Massachusetts, went to his professor Charles Jackson for advice after Wells failed. Morton had been present when Wells, his former mentor and work partner, performed the operation. Jackson advised Morton to use diethyl ether instead of nitrous oxide because it is stronger. In the ether dome in the Massachusetts General Hospital in 1846, Morton successfully removed a neck tumor without the patient making any noise. Because Morton was a dentist and therefore could only prepare and administer the ether, this demonstration was done with John Warren, the physician who actually performed the operation. Warren was recorded to have said,
"Gentlemen, this is no humbug."
After this, Morton was credited with being the first to successfully use an anesthetic. This caused a lot of dispute and tension among everyone in the field at the time. After the successful use of anesthesia, surgeons could cut much deeper into bodies and try various new surgeries that were never even thought of before. While before anesthesia, the patient was always fully conscious, with anesthesia, the patient would be peacefully sleeping, and the surgeons could perform operations that would have been thought of as miracles previously. They could perform open heart surgery, remove or replace organs, and so many other types of operations.
Many C-sections were performed on women after anesthesia was invented, as opposed to the previous method of crushing the skull and pulling out the corpse of the baby. The use of anesthesia immensely reduced the opposition to dental surgery because people had previously viewed the pain as not worth it. This greatly improved the extremely bad conditions of Americans' teeth.
With the acceptance of anesthesia came the acceptance of the germ theory, leading to sterilization and better health regulations. This happened because once patients were no longer dying from the shock and pain of surgery, it became clear that something else was causing the other unexplainable deaths. Only then did surgeons realize how important sterilization was. Previously, surgeons would grab and remove cysts with their unwashed fingernails and sharpen their amputation tools with the bottom of their shoes. They also believed that pus was essential to healing, so they let it accumulate. Before the modern acceptance of the germ theory, if the patient did not die from the surgery, they often died of infections.
Once anesthesia was accepted, innovation after innovation occurred. Doctors found new ways of administering anesthesia, such as by injection into the vein, blocking off nerves, or through enemas. Doctors also began finding new substances to use as anesthetics and brought back nitrous oxide. Further research and development also enabled doctors to anesthetize the whole body or local areas, depending on how major or minor the surgery was. The highest honor of all for Morton and the rest is silence. The silence in every operating room in the world. No longer are these rooms filled with the terrible screams and cries and groans of suffering patients. No longer does the knife that heals give pain.